The National Cancer Society of Malaysia (NCSM), also known as Persatuan Kanser Kebangsaan Malaysia, is the country's first non-profit cancer organisation offering support, care and education to the general public and those impacted by cancer. So NCSM are tax-exempt charitable organisation that was founded in 1966 and is recognised by the Registrar of Societies Malaysia and Malaysian Societies Act, the late YAB Tun Abdul Razak, who served as Malaysia's Prime Minister at that time, officially opened the society, which was founded by the country's first oncologist, Dato' Dr. S.K. Darmalingam. So basically, NCSM provide holistic cancer-related service to the cancer patient, caregivers, and the public through their 6 centers, which is one of them is Cancer and Health Screening Clinic. One of the implemented program by NCSM is Direct Donor Debit Program. It's a donation program created specifically to encourage members of the public to contribute to NCSM cancer care and support services, and it is to make sure that the community services provided by the NCSM operated efficiently. The DDP directly and promptly support NCSM effort to inform the public about cancer and how to prevent it. So one of the objectives of this program is actually for a fundraising channel. For more than a decade, the DDP has proven to be an extremely effective means of fundraising for numerous charitable organizations. Other than that, to lower the incidence of cancer by educating the public about prevention, screening, and early detection of the cancer.
So now I would like to present about the activities that is made by National Cancer Society Malaysia (NCSM). So as we all know, NCSM is an organisation that is making an effort to fight cancer. So they have made activities offline and online to help with this. There is a couple of examples that I have made, I put in this slide to show that they have created several activities. So first of all, they have created outreach activities or outreach to the communities, whether it's in the urban area or rural area, talking about cancer, giving the awareness and such to make sure that the people know that cancer exists. And then there are also screening and vaccination programs that they have made, which all of us have participated in April, which one of them that have been organised here in Rao, which is in SK Chungcheng, where they have made a screening test for breast cancer and also prostate cancer, where we check whether or not there's an early sign for cancer, and if there is so, we will suggest them to go to the hospital to get cured. And lastly, there's also the online activities such as the SK Darmalingam lecture series, where he talk about the stakeholders in cancer world, such as doctors who are trying to find a cure, researchers, and the progress whether or not we are trying to find the cure of cancer, as well as tips to prevent cancer itself.
Moving on to the initiative and contribution, the National Cancer Society of Malaysia provides several initiatives designed to assist Malaysian patients who are facing cancer. The initiative include financial assistance, subsidy screening programs, support group, accommodation and counselling services. They offer needy cancer patients and their families up to RM25,000 financial help for their medical treatment and free accommodation for underprivileged children receiving cancer treatment and their caregivers who must travel long distance for treatment. The National Cancer Society of Malaysia also comes with various contributions, including education, care and support. One of the contributions is to minimize cancer in Malaysia by raising public awareness on the prevention, screening and early detection of the cancer through education. They provide many programs such as health education and health promotion programs. Besides, they also release educational materials in printed health materials and digital health materials. All these materials are suitable for Malaysians of all ages. The second contribution is through care. Their objective is to increase access to cancer services in Malaysia by providing affordable and advanced screening and diagnostic facilities. The last contribution is support. They empower individuals and those affected with cancer to maintain the highest possible quality of life.
The strength of the National Cancer Society of Malaysia is they have a lot of expert and experienced staff. Because of that, it will help this organisation to achieve their goal more efficient and more effectively. This is because the staff in this organisation are expert in their role. Other than that, when they have a lot of expert worker in this organisation, it will help to reduce the stress among the worker. This is because when the staff cannot do their job, other staff and worker can help them to solve their problem and job. Now, the weakness. The weakness of this organisation are they having a lack of promotion for their programs. This can be seen when the program that be implemented by this organisation not receive a good response and involvement from the local people. For example, when the local people come and attend to the program that be implemented by this organisation, they often ask what kind of service that being provided here and if there any charge that they need to pay if they want to get the service.
opportunity. The National Cancer Society Malaysia relies on collaboration with external organisations. Collaboration can be understood as the act of two or more individual or organisations that are working together to achieve shared goal. It is about pooling resources, knowledges and expertises to create something real. Hence, collaboration is a powerful tool in the National Cancer Society Malaysia to achieve its mission of fighting cancer. There are some collaboration that we can see, which is the collaboration with Subang Jaya Medical Centre in Adults Home of Hope. Here, SJMC is providing the essential supplement nutrition for cancer patients. Through this, Datuk Dr. Saungkari Somasundram and CSM President has said that this collaboration help ease the burden of Adults Home of Hope. Besides, the collaboration too that we can see is Memorandum of Understanding with Ninja Van. Although Ninja Van is a courier service company, but this collaboration that NCSM create with it is as a clever method for them to survive. So, the collaboration acts as a big cornerstone of success for NCSM. Trade, views and criticism from the community. Community assume NCSM prioritizing only certain cancers such as breast cancer and other family cancers, but it is not like that. There are many types of cancer which NCSM focusing on. However, it is become like this because there are lack knowledge in the community and lack information from the NCSM itself. Next, limits of reach in remote area too has been an issue for NCSM from the community. Plus, the screening and support services only being said by community and CSM only concentrated in urban areas. So, this lead to criticism from community too. Next, there are raising question, which is how the long-term sustainability and ongoing support for patients will be done. This raised because the fundraising has been an issue. So, the SCSM must try effectively to make sure their objective in creating a healthy community is successful and satisfying the patients or the customer of the organizations.
Okay, next I will explain about the recommendation of National Cancer Society Malaysia. So, I want to give a recommendation to NCSM, National Cancer Society Malaysia weakness. So, the weakness of NCSM is lack of promotion. So, basically, NCSM was established in 1966. However, not many people know about NCSM. So, what is the main factor or main reason that caused this action? So, actually, NCSM doesn't make many promotion or any campaign to promote what they delivery or what type of service that they deliver, that they prepare for the citizen. And their social media isn't active like other NGO social media. Like as we can see, their TikTok and their Instagram, like the latest content maybe 1 year ago, 2 years ago, and the content that they make isn't attractive, isn't fun at all. Like when I see it, I think like they need to improve a lot in the term of promotion and publicity. So when they promote their when they improve their promotion, so many people will know about NCSM and they will know what NCSM provide in the case of cancer. Next, I will give recommendation of NCSM trait. So in NCSM, there is actually a trait which is public perception and acceptance of cancer. So actually, when we talk about cancer, many people will think that, oh, I will die, or I will die because I have a cancer. But actually, it's wrong. Literally, cancer has many types. Cancer has many stages, like stage 1, stage 2, 3 and 4. So, when someone have a cancer, maybe they have a cancer in the stage of 1 or 2, it is easy to be cured. Okay, so when they have a cancer in the stage of 3 and 4, it is hard to be cured. So that's why our Ministry of Health, Dr. Zulkifli, said it is important for the people to have to realize the importance of early diagnosis of cancer, so that when someone do a early diagnosis, so maybe they will know, oh I will have a stage 1 cancer. So the nurse or the doctor can take immediate action to prevent the tumor from spread more. Okay, and then when they do early diagnosis, they can prevent the tumor or the cancer to be on the upper stage of cancer. So the death case in Malaysia by cancer can be decreased. In summary, the National Cancer Society of Malaysia (NCSM) plays an important role in Malaysia's fight against cancer. The goal of NCSM's broad services, including patient assistance, education, cancer screening, and research, is to reduce the impact of cancer on people and society. Its commitment to enhancing cancer care in the nation is demonstrated by its mission to provide cutting-edge diagnostic and treatment facilities, as well as by its initiative to educate the public and support cancer patients.